Look at your feet. Not tomorrow, not after this video, right now. Because in the next few minutes, you may notice something that could change the way you think about your health forever. Most people believe diabetes begins with a blood test. They think the first warning appears when their doctor calls with unexpected lab results. But that's not always how it happens. Long before a diagnosis, long before you feel seriously ill, and sometimes years before your blood sugar reaches dangerous levels, your body begins sending quiet warning signs. The surprising part is that many of those warnings don't appear in your chest, your stomach, or even your heart. They often begin in the part of your body that most people pay the least attention to, your feet. Every day, millions of adults over the age of 60 experience small changes in their feet, a little tingling, a burning sensation at night, dry skin, a sore that seems to heal more slowly than usual. Most people blame aging. Others blame uncomfortable shoes. Some simply ignore the signs altogether. But what if those small changes weren't random? What if they were your body's way of telling you that something much more serious is happening beneath the surface? Today, we're going to explore 9 early warning signs that may appear in your feet before diabetes is ever diagnosed. For each sign, you'll discover what many people mistakenly believe. What could actually be happening inside the body? And one simple daily habit that may help protect your long-term health. My goal isn't to frighten you, it's to help you recognize problems while there's still time to take action. Because when diabetes is discovered early, many people are able to manage it successfully through lifestyle changes, medical care, and healthy daily habits. The earlier you recognize the warning signs, the more options you may have. Think about this for a moment. Your feet contain thousands of tiny nerves and some of the smallest blood vessels in your entire body. Because these nerves and blood vessels are so delicate, they often react to changes in blood sugar long before larger organs begin showing obvious symptoms. That's why healthcare professionals routinely examine the feet of people living with diabetes. Sometimes the feet reveal a story that the rest of the body hasn't told yet. Unfortunately, most people never think to look. A recent conversation with one viewer stayed with me. He was 69 years old. He told me he'd been feeling a slight tingling in his toes for nearly a year. It only happened at night, he said. I thought it was just because I was getting older. Then the tingling became more frequent. Soon, he noticed that small cuts on his feet seemed to take much longer to heal. Eventually, a routine medical checkup revealed something he never expected. His blood sugar was much higher than normal. Looking back, he realized his body had been trying to warn him all along. He simply didn't know what those warnings meant. Stories like this happen every single day. And that's exactly why this conversation matters. Not because every foot problem means diabetes. It doesn't. Many foot symptoms can have completely different causes. But some changes deserve attention, especially when they appear together or continue getting worse over time. Awareness is one of the most powerful tools you have. Before we begin the first warning sign, I'd like to ask you one simple question. How often do you actually examine your feet? Most people check their face in the mirror every morning. Many check their weight every week. But very few spend even 30 seconds looking at their feet. Tonight, before you go to bed, take a moment to do exactly that. Look at the skin. Look between your toes. Notice the color. Pay attention to anything that seems different from a few months ago. That small habit could one day help you notice something important much earlier than you otherwise would have. Now, let's begin with the very first warning sign. It's also one of the most common, and it's the symptom that thousands of people dismiss as just getting older. Tingling, numbness, or that familiar pins and needles sensation in the feet. What makes this sign so easy to ignore is that it usually starts very gently. At first, it may only happen once in a while, perhaps after sitting for a long period, or just before going to bed. Many people simply shake their feet, stand up, walk around for a minute, and forget all about it. But when this sensation begins appearing more often, without any clear reason, your body may be asking for your attention. In the next part, we'll explore exactly why this happens, what it may mean, and why ignoring it could allow a hidden problem to continue developing quietly in the background.